Okay, that is BC's Premier David Eby taking questions from reporters as he arrives here in Ottawa. He, along with his provincial counterparts, are set to meet with the Prime Minister tomorrow on the very thing you heard him discuss, the prospects of one overarching deal that would see the Canada Health Transfer increase, and then bilateral health deals that will target each province's specific needs. I want to bring in the front bench. They're with us this evening to talk about how likely that is and what the stakes are like for that meeting. Former Liberal Cabinet Minister Miriam Monsef is here. She's now the CEO of Onward. Former Communications Director to Erin O'Toole, Melanie Paradis, is here as well. She's now the President of Texture Communications. NDP strategist and Monk & Associates principal owner Kathleen Monk is with us, as is La Presse's Ottawa Bureau Chief Joël Denis Bellevance. Hi, everybody.
Hi there.
Very nice to see you. I know you've been there, JD, at the meetings, talking to the premiers. How likely do you think this thing, I know they're all saying we're not going to sign anything, but do you think it does set the stage tomorrow for a deal quickly thereafter?
That's the expectations on the part of the federal government, but also on the part of some provinces, namely British Columbia and Ontario. Quebec will want to make sure, if I can speak about Quebec, they want to make sure that there's no conditions attached to it. So
I heard Premier Legault say that, yeah.
So they're looking for asymmetry. That's the constitutional word that is very much revered in Quebec, asymmetric federalism. But I think it will probably set the stage for a deal quite quickly, I think, bilateral deals. And there won't be any negotiations on the overall increase of health transfers. That's going to be take it or leave it, but it's going to be, they're going to take it. And then negotiations will take place on bilateral agreements with every province. So that's to be followed.
Yeah, and when it comes to those bilateral deals, Kathleen, like everything I hear is Ontario's ready to sign on the dotted line. They've been working the back channels. Saskatchewan, there might be some resistance from due to like some friction between Scott Moe and the Prime Minister. And then Quebec is always the big question mark, as JD points out, for a number of reasons. What do you think might happen, and how high do you think the stakes are?
I think it's going to be really difficult for those provinces who are looking to slow walk these deals, to slow it down, to slow down the negotiations, to do so, because there is, as JD says, the overwhelming pressure, not just from Ontario and BC and possibly Newfoundland as well, to move forward on these things. That these provinces have deadlines too. They have budget deadlines. And I think, as we just saw on that Eby clip, is that they understand what the communication challenge is right now. If these premiers are still going to be talking about and wrestling with, ideas around jurisdiction and funding formulas, they will have lost. And conversely, if Prime Minister Trudeau comes out tomorrow with big dollars and big ideas on how we can improve patient care, he's going to win the day. And the Liberals need to have a win right now. And they can do that with those big dollars and with real clear ideas and accountability on patient care.
Melanie, how high do you think the stakes are for both, as Kathleen has outlined, I think, very well, for both the premiers and the Prime Minister? Like, how bad does everyone need a win? And, including Canadians who, by the way, are living through this healthcare kind of nightmare.
Yeah, Canadians absolutely need the win the most. That's for sure. I completely agree with what Kathleen has noted. And I would add that Canadians don't care who's responsible. They haven't cared about this for a while. They just want access to better healthcare. They want more access. And we've been talking about this for 2 years now. The premiers have been asking the federal government for a better deal for 2 whole years. So a lot has gone into these negotiations. I think I'm really looking forward to hearing what Premier Ford has to say at the end of these negotiations, because he's really been leading the charge, especially in the past few weeks. We've heard him saying, we need to get a deal. We need to get this fixed. People can't be waiting around for healthcare to magically improve. We've got to sit down, negotiate this, come up with a plan, and get going. And so I'm really looking forward to hearing what he has to say out of these negotiations. I think it will be quite telling.
Miriam, what's so interesting in what Melanie just outlined is that how many years have we been covering politics, you living them, when Doug Ford was not the greatest friend of the Trudeau government and vice versa. And now really he was the one that essentially publicly broke the impasse around strings attached and conditions and whether this meeting would happen. He's the one who first said, I'm willing to accept those conditions if we can get some more money. And from there, it kind of snowballed, and now there's a meeting. How significant do you think this meeting potentially is? I had someone on my radio program today say maybe it was Tom Mulcair, actually, the former leader of the NDP, say it's like the most politically consequential or significant meeting in like a generation.
Yeah, and every Canadian who's, experienced what it's like to not have a family doctor, who's taken their infant to the emergency room and has waited over 12 hours, is wondering, will I get better results? Will there be additional investments? when my loved one needs elder care or mental health care, will they receive it in a timely and dignified way? So certainly we're all appreciating the goodwill that seems to be out there that says we're getting closer to a deal. As JD said, tomorrow will not be the final meeting. There's more work to be done. I'll also be looking for, the key to success of this big innovation, this 10-year plan is our care workers, those on the front lines. Is there going to be an acknowledgement that these folks are burnt out, that they need to be paid better, that the hate and the aggression that they have experienced in the workplace, particularly over the past 3 years, will be addressed? And of course, there's room for innovation. There's a necessity for it. But what I'm afraid of is building into a system incentives to keep people sick. So what kind of safeguards will be in place to prevent people making profits from sick people? What kind of financial oversights will there be? What kind of accountability will there be? And that's the true test of the leaders at the table and the remainder of the work ahead beyond tomorrow.
I've got like 30 seconds, JD, but just jumping off that, I've seen no indication that there's going to be any constraints placed on, using private for-profit clinics. And we've, the federal government has not signaled that. And I don't think provinces are expecting it.
As long as you don't have to pay with your credit card. That's the bottom line for Ottawa. You show your Medicaid card, and that's it. And that's the bottom line. And Jean-Yves Duclos has mentioned that, and the Prime Minister as well. So
yeah, I'd be surprised if they went another direction, but I know there's a lot of people asking them to take a second look, including Jagmeet Singh.